Okay, well, since we have Sarah, we might as well go ahead and get started. And then we have Heather, I can give her some feedback on this project as well. So good morning, everyone. Thanks for joining us, myself and Brian. My name is Tanisha Jackson. I work for the Child Care Resource and Referral Network. And with me, I have Brian Courier from the Office of Water Programs. And today we're going to be talking about AB 2370, which is the assembly bill that requires child care centers, licensed child care centers, to test their water for lead. You will be getting some information from some of the work that we do at the network, as well as the work that's being done from the Office of Water Programs, and then some regulation information from CDSS. So let's get started. Oh, there's what I was looking. All right, so what is Assembly Bill AB 2370? It's the requirement, as I mentioned before, to test drinking water for lead. This requirement is for licensed child care centers only. The following July 28, 2021 written directives do not apply to family child care homes or to buildings constructed after January 1, 2010. Buildings constructed meaning the actual building date, not the licensee date. So it's not the date of when the provider was actually licensed. It's when the building was actually constructed. So we definitely want to make sure that we stress that. July 28, 2021, the written directives issued for lead testing of water in licensed child care centers pursuant to AB 2370, Chapter 676, statutes of 2018. And the PN was updated and released in December of 2022. So we'll talk some more about that one. The available lead grant funding for child care facilities, licensed child care providers. This is a lot of information. I'm gonna try to get through it pretty quickly without boring you. Licensed child care providers may apply for water testing for the grant through the provider portal on the Office of Water Programs. The website is here. Licensed providers are requested to complete a pre-sampling verification form and also asked to submit a facility sketch with markers indicating where the water fixtures are located within the facility. The facility sketch does not have to be a Picasso sketch. It can just be a simple sketch, just making sure that you identify where the water fixtures are located. OWP, which is the Office of Water Program, will review the grant funding available with the providers, and providers will schedule availability for sampling, and they will prepare for sampling by completing the required documents, Child Care Center Sampler Checklist Form. You can find this information on the licensing website. You can also get this information off of the OWP portal for the authorized samplers to test the water. All testing of samples shall use the ELAB, which is the Environmental Laboratory Accreditation Program Certified Lab for testing, and all testings of samples shall use the EPA method 200.8 with the minimum reporting level of 1 part per billion. This statement basically is for analyzing samples for certain substances. The designated testing method must be the EPA method 200.1, and the minimum reporting level should be set at 1 part per billion. All results of lead testing shall be posted on the California State Water Resources Control Board's website. And the Child Care Center shall direct the external certified water. So this is the tester outside of the grant. So they should direct the external certified water sampler to work with an ELAB certified lab who will provide the results of lead testing to the following. So they'll provide it to the State Water Board electronically. The certified external water sampler, the results will be provided via email or paper, and the licensed child care center can request for the results to come via email or paper. California's action level for lead in the water at child care centers is greater than or equal, should be no greater than. Am I correct, Brian? 5.5?
The action level is greater than or equal to 5.5.
Okay, greater than or equal to 5.5.
Mm-hmm.
All right, each water outlet shall be subsequently tested at least once every 5 years, calculated from the date of the initial testing. So if you tested in 21, your next testing date will be 26. All right. And the lead testing application process. So as we mentioned before, your steps to apply for the lead testing grant, you'll go to the portal where the link is here. Your first page on the portal that'll pop up when you click on provider portal is this actual page number 1, provider portal. You'll input your facility number and your facility county. And then the next page will show, it will ask you, is this your facility number? You'll say yes, it's correct, or no, find another facility. The next will be your child care center information, the physical address. If you need to update the address, go ahead and click update. It'll give you the option to update. Your mailing address, this is the address to mail outlet labels, site preparation instructions, and any fixture replacement reimbursement checks you may receive. So you want to make sure that this is accurate and correct. This part here, the original year built, was the building that houses the child care center originally constructed prior to 2010. If it was constructed before 2010, you want to make sure that you mark yes. Okay, if you mark no on accident, then we'll have to go through a manual process to get you back to this application process to redo it so we can get it fixed. But you want to make sure that you take your time with this portion and click yes, so you can go on through the rest of the process. This is going to ask you about your facility number. If you want to add another license or if you want to delete, it's going to give you the option here to do that. The primary contact information. This is the email address that must be used in the future to access the provider portal for this child care center facility, and that will receive a copy of all emails that we send to this child care facility. You want to update that if you need to, your contact name and phone number here. You want to make sure all of this information is updated and you have access to your email or the phone that you're going to be using when you apply it, when you input this part of the information. Then you have your eligibility form, and this is some information regarding the eligibility form. It basically is talking about the construction building, and it must have the drinking water tested for excessive lead levels. If you are interested in receiving state assistance to meet this requirement, the form provided below must be completed by the licensee or the administrator or director to determine if your center is eligible. I'm sorry, I think I did that block again. It's showing. I'm sorry, you guys. Infant centers will be assisted first. Even if your center does not offer infant care, you are still encouraged to complete this form because additional child care centers will be contacted if there are adequate funds to serve other age groups. To ensure your child care center is considered in the prioritization process, please complete this form immediately and please answer the questions below to the fullest extent possible. Inaccurate or missing information may affect your grant eligibility. Use one form for all facility numbers located at a single physical location. I cannot move this block.
Yeah,
Brian,
it has been. Yeah, it has. I do see it. It has been going away. So we lost our magic touch.
Yeah, we did. I'm not sure. Uh-oh, I don't want to
Oh,
do that.
no,
Nope, that's not what I wanted to do.
it was. We had this licked, we promised.
Now it's going to go down here to the bottom. All right, I can work with this for now. For more information about this requirement, see the CDSS Provider Information Notices 1904 CCP and CDSS PN 2001 CCP. Check with your landlord to confirm the age of your building, the adult general partners of a partnership, controlling partners in a limited liability corporation, county, city, public agency, or other governmental entity have the authority and responsibility to operate a licensed child care center. The licensee or the adult designated by the licensee to act on their behalf in the overall management of the facility. So here is the child care center details from the information that you put into the system. And it shows confirmed, and it's asking to please complete the survey. So after you get to this part 7, then you'll move into the service option. And you'll just click on the type of assistance you're looking for. My facility has not yet completed the testing. I'm requesting testing services by the grant team. I'm requesting other services such as retesting after an exceedance, fixture reimbursement, consultation with the water quality expert, or future services, which is the 5-year sampling. All right. And
Oh,
I will pass it over to Brian.
yeah, it's my turn. Um, before I go over my material, I just wanted to reflect on a few things from Tunisia's talk. Um, we just went through the
Mhm.
application process, and that is, it goes very quickly in real time. I like to tell people it takes, 2 or 3 minutes to get through that application and eligibility form. It's all things they can answer off the top of their head, in most cases. Sometimes the year the building was constructed is a little tricky, and we offer a lookup tool to assist. It's still up to the child care center to take our suggestion based on our database and update that. So building age can be a little tricky to assist a center through. And then the other thing about the prioritization is that we're far enough along in this process that, there's so many childcare centers that paid for their own sampling, and we still have a good amount of funding left. So we're not turning anyone away. So right now, the message is if there's a center that needs testing, have them apply. And then the other takeaway is that we're hearing that testing runs, depending on how far away you live from a sampler and the how many outlets you have at your facility. But we're hearing numbers around $1,500 to $3,000 per testing event. So this really is a really nice cost saving opportunity for the child care center to test through Sacramento State. So we want to make sure that's included in our messaging. Yeah, that's a big number. Okay, so what have we done so far? We've tested over 3,600 facility numbers. Some of those are combination centers, and so there's something like 3,100 locations that we've tested, but over 3,600 facility numbers. And we've had, across the program, a total of, let's see, total outlets taken out of service from action level exceedances it's almost 5,000. And that's amazing. Now there's some 50,000 outlets that were tested both from grant funds and from childcare centers that funded their own sampling. So there's a ton of outlets that had no problem at all. And that's great. But the other good news is we identified a very substantial number of outlets through this program that we should stop using because the lead levels are too high. So we'll get to what our mantra is about testing and safety later in this talk, but that's good. That's success. And we often find for the vast majority of cases where they simply replace the fixture, the faucet or the bubbler where the water is coming out, that solves the lead problem. And so we also cover the cost of retesting. And we also cover the cost of replacing the fixture, the materials cost. We include cover the cost of labor up to an amount if a licensed plumber is used, but we always reimburse for materials cost, regardless of whether a licensed plumber was used. And the current allowance, I hope I'm not skipping too far ahead, but $450 per outlet. And we find that about half the time that covers all of the cost. So backing up to my comment on action level exceedances and discontinuing use, that is the requirement of the written directives. That is, in a way, that is the immediate remediation. Child care centers are required to discontinue use of that outlet. They can take actions to replace that outlet and retest, but they only return to service after they get a retest result that says it's a passing result, it's below 5.5 parts per billion. So that's why our mantra is a tested facility is a safe facility. And we really want to hammer that message home. In the mass media, there's messaging on, 1 in 4 childcare centers, for example, have an action level exceedance. I would change that slightly. It's not have, it's had. And once we test, we stop using those outlets. So across the board, we're assured if it's tested that even in the worst cases, the highest concentrations, children are no longer being exposed to those concentrations of lead in their drinking water. So it's really good news of the work that's being done through this program. Okay, Tunisia, back to you.
Thank you, Brian. And you will see, take a deeper look into why this is excellent. This work that's being done when we take a look at the damages of what lead can result to, lead poisoning. Okay, so just some information from CDSS, some current actions. CDSS continues with an ongoing effort to monitor for lead testing in licensed child care centers. Monitoring meaning coming in for those annual visits, providing resources. They're also providing information from the Office of Water Programs, myself, to have the child care providers get access to this free service. So they're moving forward with that. That's the right here and right now. Child care facilities will continue to work with their licensing program analysts through the process. And as Brian mentioned, for the remediation process, that first thing to do is to stop the usage from that water fixture. If there are some contaminants found in the testing, we want to make sure that that's happening. You can contact your LPA to move forward with any other plans of correction that they will allow in the child care facility. Some child care facilities have water sources of water, like water programs or water services that come and deliver water. They're using water bottles where they are replacing water bottles with new water bottles, but not filling up the water bottles with the water from the faucets. So a water service can be a plan of correction. Water filters, we ran into that too with childcare centers using water filters. So, but mainly the water service has been one of the plans of correction other than the remediation or the stop usage. So some information that licensing is providing to the childcare centers. The PINs, the 2206, the lead testing in childcare centers is frequently asked questions. You can get a lot of answers from the fact sheet. From the FAQs that they're providing to the childcare centers. A lot of questions are being asked, and a lot of information is there, just in detail, or some of the things that you could do, or you're not sure of, or you're not sure if licensing is going to approve it. It's in those FAQs. The PIN, the 2121.1, the CCP, this is the release, the updated written directives for the lead testing. And it also has the self-certification form, the child care center sampling checklist form, which is what I spoke about earlier. Some resources listed on the Sacramento State University Office of Water Program website. The CDSS list for local regional offices. If you're not sure where the regional office is that you belong to, that list is there for you. CDSS lead testing information website link, the water testing information. And because my thing is blocking, I have to move it up a little bit. And then CDSS email address for general lead testing questions at cccwatertesting@dss.ca.gov. So that's just some additional information from licensing. All right, and I'll pass it back to Brian.
Okay. Well, I hinted on this. We still have funding available for testing through June, and that's still officially correct. So help all of us push hard for enrollment to take advantage of those funds. But I will say that in the last few weeks, we have a lot of momentum to add some funding after June. So starting July 2025, I'm working with Tunisia and Kelly here that online uh, for another 2 years of funding. So we'll be happy when that's official, but we're working on that. So it's kind of a an early hint of things to come. But until that is actually official, I think we push hard, use the available funds as much as we can. I talked about the remediation cost of up to $450 per fixture. Now, what some people don't know, and we have a minute, so I'll explain, is that we calculate that as an average across all the replaced fixtures. And the reason we have advocated for that with the funding partners is because the cost of fixtures vary so much. You can replace a sink in a classroom and the faucet there, you can replace the faucet for a couple $100. But then the bubbler in the hallway or the drinking fountain, like $1,000. So what we do is if you had two exceedances for those two, is we take the two and we um, average out those costs so that the total eligibility is simply 450 times two. So it'd be $900. So if you added up that cost, $1,000 for a bubbler, $2,000, $200 for a fixture, that'd be $1,200. We would reimburse up to 900 of that. So it's not individually, it's as a group. We reimburse 900 would be the limit. So fun fact for you. Let's see, we are just now starting a pilot project for the 5-year recurring sampling requirement. And what's really nice about that is it resets the clock for the 5-year sampling. So as Tunisia said, if you test in 2021, you're not due until 2026. But if you take advantage of the funding that we have right now, you jump on that, you reset your clock. So if you test, let's say we're almost 2025. If we test 2025, then you're not due again until 2030. So that's what we're telling everyone. Please reset your clock, jump on this when we know we have the availability of funding and it's certain. The other advantage of this is it's providing really helpful data back to CDSS on really the efficiency of this program. Do we need to retest every outlet all the time forever? Every 5 years forever. And we're hoping that we can make that a little more efficient, but we need the data to prove our theories. So it's working with the child care centers here is going to be critical to get that data. All right, so the wrap up here is just encouraging all centers to apply for assistance, even if they tested previously and they paid for their own sampling. We would encourage them to apply for sampling moving forward. Okay, our prioritization is going to be for those that we've already tested. And so that I don't think that that's going to be a practical consideration just because the recruitment for the new testing program is a little on the slow side. So the message is still, if they apply, they're going to receive service, and we would have to have a pretty drastic change in enrollment for that to change anytime soon. Okay. I I don't see the little note on the bottom of this slide, Tunisia, because it's blocked out, but I think I covered everything. Tanisha's moving it for me. Oh yeah,
Yes.
childcare centers. That was simple. Okay, that
Yes,
I
that one
figured
is a
out.
simple one,
CCC's is
yeah.
childcare centers. That one I know.
And I have a question too, Brian.
Yeah.
For centers that test using an
Hmm.
external service
Yes.
and they find some contaminants in the lead testing and they have to retest,
Hmm.
are they able to do they have to retest using the external service, or can they go through the grant for the retesting?
They can go through the grant, and we've had several childcare centers that have done this.
Okay.
Um, and for whatever reason, uh, and we just put them right on the schedule, and we'll just do a little bit of sleuthing so that we can see the data from all testing inside and outside of the grant. So we just do a little bit of homework to make sure we
Right.
understand the situation with the child care center. We're never jumping in blind, and then we're able to get them the correct level of retesting. So we'll make sure that they're only retesting where they previously had an ALE, or maybe
Okay.
they're expanding their operation to, their licensed operation, and they're using a new room that they've never used before, and they need to test a new outlet. So we really have adapted the program to be flexible to almost any conceivable scenario, but I guarantee everyone will come up with a new scenario, but we'll adapt, we'll figure it out, and we'll make sure the childcare center is served.
Thank you. And that's even better news on top of everything else in which you've explained, because that gives the child care center who feel as though they missed the resource of the free service, it gives them the opportunity to access the free service the second time around.
Yeah,
Um,
definitely.
so that's a
Yeah.
plus. It's a win-win for everyone.
Mm-hmm.
All right. I would definitely let that be known. So spread the news. A tested facility is a safe facility. It's pretty much, this is how I look at it when I'm digging and doing work and searching for facilities that pop up on my radar that I need to contact. I'm looking online. I'm looking through CDSS transparency. But for example, I'm a parent, because CDSS transparency website is for providers and parents. I'm a parent and I'm looking for a child care center, and I'm baffled between two centers on my street that are really good centers according to word on the street. I've taken a tour in these facilities. I've seen amazing programs being ran in these facilities, and I'm excited to put my child into one of these facilities. But then I find on transparency, when I'm looking through some detailed narratives for the facility, I'm looking at annual visit information, um, what's the happenings with these facilities, and I see that one facility has tested for lead, and the other one has not. So that becomes the determining factor for me as a parent to say, this facility is a safe facility. This is the facility that I want to put my child in. So we want to make sure that we spread the news. We let the child care providers know, get your tested information, get it posted, let it be shown, share with your families. This information should be asked at the time of enrollment, but we want to make sure that the parents know what to ask and the providers know what to provide. So we'll talk a little bit more about that too. So yes, as Brian said, the mantra is a tested facility is a safe facility. So let's talk a little bit about this lead thing that we've been talking about. It is harmful to all of us. When we're looking at lead, we're looking at, it could be lead in water, toys, paint, certain types of materials used in the facility. We just want to be all things lead um, free. It's harmful to everyone, and it damages the brain, the kidneys, the liver, the blood, and the reproductive system. So for young children, they're most vulnerable. Their nervous systems are still developing, and they absorb 4 to 5 times more than adults, which can cause intellectual disability, underperforming at school, and behavioral issues. In adults, lead exposure increases the risk of ischemic heart disease and stroke. In pregnant women, lead exposure damages many organs, but they also affect the developing of the fetus. So lead in drinking water presents a very real public health risk, especially for children. In children, lead exposure can cause damage to the brain and nervous system, slow growth and development, learning and behavior problems, and hearing and speech problems. No safe level of lead exposure in children has been identified. So this is good information, a good poster that providers can post in their facilities, and we can share with our providers that we work with in our service areas. This is an EPA schools checklist, something that parents should or could use when they're going down the list for the healthy schools. Parents should, like I mentioned before, inquire about the lead testing at the time of enrollment. You can get the information. Providers can use this information. Schools that are on the campuses of public schools, facilities that are on the campuses of public schools can have this information available to parents. But we want to make sure that we are spreading this awareness so parents will know the questions to ask. And like I mentioned before, the providers will know what information to provide. Lead Prevention Week is, let's see, we just passed October 20th through the 26th. Childcare providers could have sent home information in newsletters, posted on their website, shared the National Lead Poisoning Prevention Week poster, which is this one. It comes in different languages. But you want to make sure that you let your families know that your facilities have been tested. And for the R&Rs, you want to definitely let the providers know that you have the resources to provide to the facility so they can then provide those resources to the parents. Let's keep on going. And then we have a short little video that we will share here. Hold on 1 second. Okay, I'm sorry about that block.
Welcome to the U.S. Environmental Protection Agency's
Can you hear it pretty good, Brian? Is everything
Yep,
good?
we hear
Okay,
it.
cool. Okay.
3Ts lead sample collection video. This video expands upon materials developed in support of EPA's 3Ts program to reduce lead in drinking water in schools and childcare facilities through training, testing, and taking action. This video will show how you can identify sources of lead in drinking water at a school or childcare facility. We will walk through, step by step, how to sample for lead throughout your facility to help keep your school or childcare community safe and informed. For more details on each of the steps covered in this video, see the EPA 3Ts lead sampling field guide at www.epa.gov/safewater/3Ts. Lead in drinking water most often results from corroded plumbing materials that contain lead. Children are most susceptible to the effects of lead because their bodies are still developing. Therefore, they tend to absorb more lead than adults. In children, lead exposure can cause adverse health effects both physical and behavioral, including impaired growth, reduced attention span, hyperactivity, and learning disabilities. There is no safe blood lead level for children. The best way to know if there is lead in drinking water is to test for it. That's where you can help. Step 1. Find a certified laboratory. If you are served by a water utility, they may test for lead in your drinking water upon request. Otherwise, contact a state-certified lab. The lab will either collect your drinking water samples for you or send you the materials to collect them yourself and ship them back. If you need help finding a certified lab, the EPA 3Ts lead sampling field guide can provide helpful direction and is located on the EPA 3Ts website. Step 2. Prioritize your fixtures. Once you have found your state-certified lab, you need to identify what fixtures you want to sample, prioritizing ones that are actively used for drinking and cooking. A fixture can include drinking water fountains, kitchen sinks, ice-making machines, classroom combination sinks, nurse's office sinks, or any other sink known to be used for human consumption. Step 3. Create a coding system. To prepare for sample collection, develop an easy-to-read coding system to create individual sample IDs, which can include the floor number, room number, outlet type or name, and a sample number. This will allow you to easily identify your specific sampling location and properly label your sample bottles so that the lab knows the exact fixtures the samples were taken from, as well as the type of sampling that was conducted. The EPA 3Ts Data E-Trackers, shown here, can assist with tracking and documenting sampling results and any actions you take if lead is detected. These can be accessed by visiting the EPA 3Ts website. Step 4. Prepare for testing. The night before sampling, post signs around your school so that others do not use the water before or during your sampling time, and be sure to label your sample containers with the sample ID. You should also gather the following materials: a pencil, a notepad, a stopwatch, sample containers, your sampling form, disposable plastic gloves, and a labeled map of the plumbing system. Other optional items that may be helpful include hand wipes or bottled water to wash your hands with. This video will demonstrate the two types of samples: a first draw sample and a flush sample. A first draw sample collects water from the fixture and its parts, shown here in blue. These results will indicate if the fixture is a source of lead in your water. A flush sample collects water from further behind the fixture, shown here in orange. Samples are taken in predetermined lengths of time after the water has been flowing out of the fixture. These results will indicate if the pipes behind the fixtures are a source of lead in the water. A flush sample is normally collected if your first draw sample has lead levels at the fixture. However, flush samples may be taken the same day as the first draw samples to reduce costs. Step 5. Collect your sample. To conduct a first draw sample, water should be sitting in the pipes for at least 8 hours, but for no more than 18 hours prior to sampling. These samples are typically collected in the morning, before the facility opens and before the fixtures have been used. When taking a first draw sample, do not flush the fixture by running the water before collecting your sample. The first draw sample is collected immediately upon turning on the water. To do this, place the container under the fixture or faucet and then turn the water on. Fill the 250 milliliter container to the top, but do not allow the water to overflow. Secure the lid on the container and set it aside. Be sure to record any observations in your sampling form. For example, was the faucet leaking? Was there any water discoloration? Did you notice a change in water pressure? The flush sample is also collected in the morning before a facility opens and before any significant water is used. Using a stopwatch, let the water run steadily, commonly for 30 seconds. Then fill the 250 milliliter container to the top with water. Secure the lid on the container and prepare for shipping. Step 6. Pack and ship your materials. Once you have collected all of your samples, you should follow the instructions from the lab to pack and ship the samples as soon as possible. Waiting too long could lead to problems that require resampling. Ensure that your samples have been properly labeled and that they are securely packed in the shipping container. Most labs will require you to complete a chain of custody form to ensure the contents of your samples are safely received by the appropriate entity. This form will typically include the date, time, location, type, and ID of the samples you are sending to the lab. The last steps are to take action and communicate. If lead is detected in your samples, EPA recommends taking action. Action may include posting a sign at the fixture to inform that lead was found, installing filters, implementing routine flushing, or removing or replacing the fixtures. You should also reach out to your public water system and use the EPA 3Ts lead sampling field guide to help you determine your short-term and/or long-term actions you can take to reduce lead levels. The guide is located on the EPA 3Ts website. When you receive your results, share them with your community, including parents, students, staff, and anyone else that might use the building. Use the customizable EPA 3Ts letter template to share results and actions with your community. By watching this video, you've taken the first step in protecting children from lead exposure in drinking water. Now you are ready to begin the 3T steps of training, testing, and taking action. For more details on testing, please review the EPA 3Ts lead sampling field guide and other resources on EPA's 3Ts website. Thanks for watching.
Yeah, if I could, Tanisha, I had just a couple of comments on that one.
Yes.
This video was a nice, almost 7-minute review for you to save you from the 55-minute training video for California specific sampling. and there are a few differences.
Yes.
And one of them is that, of course, this video assumes that self-sampling might
Mhm.
occur. It's not allowed in our state, at least not under AB 2370. If that changes in the future, we'll let everyone know. The other is the outlet labeling is very specifically identified in the written directives. We cannot vary from that. It involves a facility number and an alphabetical labeling. So we will follow that one precisely, or your sampler will follow that precisely. So those are just a couple of key differences. And another is, and this gets back to if childcare centers choose to hire their own sampler,
Mhm.
a lot of samplers that you've used in the past, like for testing for lead in paint, they're familiar with that testing, certainly, and they're even familiar with what the water systems, the public water systems, the sampling that they do for lead. That is a different protocol, and they cannot follow that protocol. For one, they
Oh,
use a bottle size that's too large. They use 1 liter, and as was in this video, we're
it
using
was
250 milliliter.
250. Yeah.
Yeah, just a quarter of a liter. So there's that difference as well. And I think I said it, the samplers need to watch our 50-some-minute training video that's available on our website. Yeah, it's a little excruciating, but that was what all the stakeholders came up with. And then, Tanisha, do I have a little time? Because I wanted to talk about filters briefly.
Yes.
Yeah, so you notice in that video that one of the possible responses is to use filters. I would just be very careful there and think about the size of the filter, where it's located, and how quickly that filter is going to get used up, or how long it will last. Is another way of saying that. Now, if the source of lead is the fixture itself, and we find that that's the case most of the time, way more than half the time, it's coming from the fixture itself. And that means that any filter underneath the sink isn't going to help the problem. So we need that water to be filtered as it's coming out of the tap. This creates a, a unfortunate situation in that the larger capacity filters are under the sink where we kind of don't need them. And the filters that are really expensive for their lifetime is the screw-in filters that replace the aerator, coming out of the faucet. And they can last as little as 100 gallons. And if you think about typical usage in a classroom with 15, 20 children, our calculation is that you might end up replacing that filter weekly. And so that over a year, that comes at a great cost. So we really, really encourage centers to replace their fixture first before they pursue a filter option, just to keep them out of that very long-term care and replacement of that filter. Replacing the fixture solves the problem. It's kind of it's the cure rather than the treatment, literally. And we would rather have the cure. Treated a filter is exactly that. It treats the water. It doesn't remove the source of lead. It just removes lead that's already in the water. So, okay, there's just a few things I wanted to follow up on that video. So that was kind of perfect prompting. Thank you, Tunisia.
Absolutely. Thank you, Brian. As I was watching the video towards the end, I was thinking about the video on the website. If I had a way to kind of like compile the information, um, or condense a little bit.
Dance. Yeah.
But I did like the graphics in the video, and as Brian mentioned, this is not a requirement for for California to self-test, but that's the reason why we're here, right, Brian? That's the reason
Right.
why you
Yep.
can contact myself, and I will get you connected with Brian and his team, and you don't have to worry about doing too much other than putting together that facility sketch and
Welcome to the U.S. Environmental Protection Agency's
answering some of those questions. So again, I'm asking to spread the news. Lead testing is still available through the Office of Water Programs. Feel free to contact myself. Let me go to that page. Oh, I'll come back to this slide. Oh, well, I thought I had my information here, but feel free to contact me. I am at the Child Care Resource and Referral Network. Brian is at Office of Water Programs. You can find us on licensing website underneath the lead testing information with the grant fact sheet. Our information is there to get you connected or to answer questions or provide technical assistance to child care providers for this free service. And let's move on to the resources. And Brian, you want to chime in on this one?
Sure. Yeah. So we have, yeah, bit of resources that we just felt the need to develop over time to give more guidance. And from how to apply for assistance to what to do after an extended closure, because we were coming out of COVID, if you don't recall, in 2021, and a lot of buildings were not being used. But then we also recognized, boy, this is going to happen again. Some childcare centers shut down for a month at a time, or they take the summer off. So there's a lot of different business models out there. And what happens is fixtures will be in a state of not being used. So what the program really wants to do at its core is to measure the daily worst case scenario of lead exposure. And that's the first thing in the morning. After a typical period of not being used, because it's that the EPA video did a good job talking about the 8 to 18 hour of stagnation time. That's what happens overnight. Of course, the water is stagnant in the pipes, and that's what gives particulate lead a chance to dissolve into the cleaner water. So it dissolves in. And so if that happens overnight, the next day, the very first sample is going to be the daily worst case. It's not the annual worst case. The annual worst case is not your typical exposure, worst case exposure daily. It's that one time a year where you shut down over the summer and you're coming back and that water's been stagnant for 3 months. That's the annual worst case. And we're not worried about that annual worst case because lead exposure is something that you're worried about chronically over time, longer term exposure and lead levels building up. So what we did in that case is, and it's on our resources, is we have our extended closure flushing guidance. And that's done in partnership with State Water Board's Division of Drinking Water. And so we talked to their technical experts and they helped us put together this flushing guidance. So that's another case. It came up and we had to develop a resource to address that concern. And then once they go through the flushing, then we still have to honor the stagnation period, but of 8 to 18 hours, not 3 months. So then you set up your facility as you normally would. Then we also realized that we needed some guidance on replacing fixtures. Oftentimes, a child care center would talk to a plumber and say, well, we would like our fixture replaced. And the plumber wouldn't recognize all of the potential sources of lead. And in the little graphic that we did right here that Tanisha is showing, is we just helped talk the child care center through some of the terminology of the components of a plumbing system that could be potential sources of lead that's really easy to get to. So essentially everything outside the wall we recommend to be replaced. So the fixture, the supply lines, and the angle stops. And then anytime you have a disturbance in doing plumbing work, you can release little bits and particles, of lead, and it gets caught in the brand new aerator that you just put on in that brand new faucet. So again, we're working on guidance that just explains to childcare centers if there's any plumbing work, take that aerator off, let all that particulate flush out, put the aerator back on, test according to the written directive that will allow those particulate to get flushed. So we're working on guidance right now to add that. It's not quite here on this list. And then when it comes to the actual components, we want to make sure that they're low lead components. And we needed to come up with some examples. And so the last four resources there help childcare centers identify for angle stops and for fixtures and for fountains what we've found to be low lead compliant fixtures. And that's all on our resources page. Thanks, Tanisha.
Thank you, Brian. That's excellent information. That just gave me an aha moment with the aerators being removed and letting that water run and flush. I didn't think about that, so thank you. All right. Are there any questions amongst us three? I'm going to stop sharing.
And for those that are reviewing the recording, which we trust will be more than just us, yeah, feel free to email AB2370 assistance at owp.csus.edu. And that's our general email inbox. You can also call the phone number that's on our website, and that will compile a email again to our service team to get back to answer those questions. I know Tanisha's already offered to answer questions as well.
All right. Well, thank you, Sarah. We appreciate you hanging out with us and getting some information on the lead testing. Feel free to get in contact with us if you need additional information. I can be reached at tmjackson@rrnetwork.org. And that will conclude our presentation for today. I hope you enjoy the rest of your conference. Thank you so much, Brian. I appreciate you as well.
Thanks, Tanisha.